Thank you, Flavia. Now, I just want to paint a graphical picture of what the statistics of cancer look like in the country, and what you see here on the screen is the burden of cancer in the country. And in the just concluded year 2018, the Cancer Institute registered more than 45,000 cases of cancer. This figure includes new cases and patients who are being followed up. This is an increase of more than 5,000 patients in a year. Let's now look at the new cases that have been handled at the Cancer Institute. They say they registered more than 5,000 new cancer cases, or what they term as incident cases. This figure has also gone up by more than 1,500. And however, the World Health Organization also shows that Uganda registered 32,617 new cases of cancer in 2018. I also want us to switch to the capacity of the Cancer Institute to handle cancer cases, and every day this same institute sees more than 150 patients in its outpatient department, and this translates to more than 53,400 patients seen at the Cancer Institute annually, and that information of course is obtained from the Uganda Cancer Institute. The institute is a 150 bed capacity facility, but only hosts 30 to 50 patients daily, and it requires up to 200 specialists on daily operations. But this is not what they have. According to the executive director, they have only 50 specialists to handle all the cancer cases. Such statistics represent a countrywide picture, but people like Gift Malidadi, who have gone through the harrowing experience of dealing with cancer, say the disease cripples you financially, socially and emotionally.
I thought it is something that I would fight alone and, at the end of the day, come out as a winner. But along the way, I honestly lost it. And that's when I started opening up to colleagues. There are so many people, there are so many colleagues, so many friends whom I think were friends, but along the way, they just gotten lost. And so friends were so important to me. Hobbies encouraged me so much, and most especially in raising finances, because like I said, that drug that we are buying, 600 milligrams at 2.7, personally, I could not have managed.
Malidadi has been battling cancer since mid-2017. The former teacher by profession and social worker says the successful completion of his cancer treatment is not yet good news to him, because he has to take some medical tests which can't be done here.
It is worrying me so much, most especially when some kind of pain resurfaces, reoccurs. It leaves me with so many questions, so many unanswered questions. Did the treatment work for me, or it did not work for me? When Dr. Henry Dung told me about that, my first question was, can that be done, around here in East Africa? He was like, no. So that left us with no other better option but, to try and look for resources, and we go to India as the doctor had recommended.
On the sidelines of the commemoration of the Cancer Day in Kampala, I asked the head of the Uganda Cancer Institute, Dr. Jackson Orem, when the institute intends to acquire the PET-CT scan machine.
Our plan is to increase our bed capacity to maybe up to about 500. But even then, we want to reduce the need for needless admissions, and what we want to do is to improve on access in the countryside by the development of regional cancer centers.
Dr. Orem also said the institute is working to manage and reduce the surge of patients at the only facility in the country expected to serve more than 40 million people.
In the next building that we are putting up, the East Africa Center of Excellence, we are going to be having actually a PET scan together with a PET MRI. So it is going to be in the country very soon.
For Gift Malidadi, this day is more than just a commemoration, but a task to everybody to do what they can with a will to reduce the burden of cancer in Uganda. Walter Mwesije, NTV.